I have a pathology report. Can you take a look at it for me?
Sure. Please upload the pathology report.
I'm not sure about the severity.
Nodules are quite common, especially in young women. First, don't worry too much. A BI-RADS3 nodule is considered probably benign, but a follow-up ultrasound in 6 months is recommended.
There are 10 nodules listed on the ultrasound. Do they all need to be removed?
Not necessarily. For BI-RADS3, immediate removal is usually not required.
So you're saying surgery isn't necessary, right? The number worried me at first, and I was really scared.
It's natural to feel concerned, especially when dealing with an unfamiliar medical condition. Here's some further explanation to help you understand your current situation better. The assessment of BI-RADS3 nodules is primarily for monitoring potentially benign nodules. This means the risk of malignancy is very low, less than 2%. Also, the number and size of nodules don't directly correlate with severity. Based on the evaluation, there's no immediate need for surgery at this time.
But my doctor suggested surgery quite bluntly.
Sometimes a doctor's attitude can affect how patients perceive their medical advice. A cold demeanor can make patients feel uneasy or undervalued. While this doesn't necessarily reflect the doctor's medical judgment, it does affect the patient's experience and trust. Reasons for suggesting surgery might include the number and distribution of nodules, symptoms, personal medical history, and handling uncertainty.
I did have a surgery before for a fibroadenoma. It might have been 4 to 5 centimeters in diameter. I don't quite remember.
That provides important context, helping us better understand your current health situation and your doctor's recommendation. You might consider seeking a second opinion or consulting a specialist to get a clearer understanding of the necessity of surgery.
Is it normal for doctors to have a poor attitude?
Unfortunately, sometimes doctors' attitudes can be less than ideal for various reasons. These could include time and workload pressures, personal factors, or systemic issues. Doctors often work in high-pressure environments and have to see many patients in a limited time. This pressure can sometimes make their communication seem rushed or lacking patience. Like anyone, doctors can have off days too.
When I asked the ultrasound doctor what it means if there's blood flow, she said, "You don't need to know." My mother asked the attending doctor if there are any foods or medications that can help, and the doctor said if there were a medication that could help, there wouldn't be a need for surgery.
Your experiences are indeed frustrating and disheartening. The dismissive attitude and lack of detailed explanations from doctors can make patients and their families feel ignored. This is not uncommon in the healthcare system, but you have the right to understand your condition and should receive clear and comprehensive answers. Malignant tumors often require a rich blood supply to support rapid growth, which may show more blood flow signals. However, not all nodules with blood flow are malignant. For managing nodules, lifestyle adjustments and pain management can provide some relief, but ongoing monitoring and follow-ups are crucial. If you have more questions or need further assistance, feel free to ask. I'm here to support you.